Hello, everyone. 3 years ago, a virus changed our entire world. One of the most important lessons we've learned during this time is that we must work on strengthening our immune system to fight off any viral or bacterial disease. Ed Costa here from Essence for Wellness in Coral Gables, Florida. I'm a board-certified family nurse practitioner and certified functional medicine practitioner. Today, we'll get some important answers from Dr. Joe Evans about what functional medicine is and how to use its approaches and principles to protect ourselves and optimize our immune system for this upcoming fall and winter. Dr. Evans is a board-certified OBGYN and international lecturer. He's the director of the Center for Functional Medicine in Stamford, Connecticut. He is also the chief of medical affairs of the Institute for Functional Medicine, IFM, and the co-director of the IFM Resistance, Resilience, and Recovery Patient Care in Time of Pandemic course on COVID-19. He now leads the IFM response to post-acute COVID-19 and has co-authored 2 recently published papers on the pandemic, with a 3rd recently submitted for publication. Dr. Evans has spoken at the United Nations on the topic of prenatal origins of violence, and he serves as the UN representative and chief medical advisor for the World Organization of Prenatal Education Association. Hey, Dr. Evans, very nice to see you. Welcome, and thank you so much for participating on this discussion and providing so much, good information to our audience.
Great to be here with you.
Yeah, thank you. Well, first, tell us about what functional medicine is, and second, how we can optimize our immune system using its approaches and principles.
Well, what I would say is that functional medicine is an approach to healthcare that's personalized and it's individualized. It centers around the patient. So it's the patient's priorities that are most important. It's science-based with medical literature, and it's focused on identifying underlying causes of disease, and in that way, we promote optimal wellness. And we do all this by looking through the lens of genetics, biochemistry, and lifestyle. And that's how we then identify changes that need to be made. Because in functional medicine, things are usually in excess, where we have too much of something. So, for example, too much mercury because we're eating too much tuna, or not enough of something. So we have a deficiency of, let's say, vitamin D. So we identify things that we have in excess, things that we have in deficiency, and try to normalize them.
Very good. And what about the sleep and immune system connection?
Well, the immune system is complex, and at the same time, there are simple approaches that we can use for immune health. So the simple approach is to say that the gut itself is the #1 immune organ of the body, the intestinal tract. So achieving intestinal health is the foundational approach to immune health. And so how do we achieve intestinal health? We achieve intestinal health by making sure that we remove things that cause problems. So we remove unhealthy bacteria that shouldn't be there. We remove parasites that may be there. We remove foods from our diet that cause inflammation in our gut. Then what we do is we make sure that we have enough digestive enzymes. We make sure that we have enough of the healthy bacteria, and we remove other things that cause the cells in the GI tract to separate. We call that leaky gut. And so then we give nutrients like glutamine, for example, or marshmallow that can help put the cells next to each other the way they're supposed to be. And of course, we have to make sure that we're having adequate bowel movements. And so the way we do this is with foods. And then we have a lot of foods that are prebiotics. And we have a lot of fiber, which are prebiotics. Fermented foods are prebiotics. And these are foods that the bacteria themselves eat. And when the bacteria eat these foods, they produce compounds called short chain fatty acids that are very good for immune health as well. And as far as the specifics, for the immune system, clearly what we're getting to, is overall immune function and then specific immune function as it relates to COVID, because COVID isn't gone yet. It's, still with us. And so, what I would say is that when we look at, immune function for COVID, we have to look at all the different ways that aspects of lifestyle affect immune function. So we all know, for example, that lifestyle factors are critically important. So how we sleep is important, because if you're not sleeping well, you're not going to have a healthy immune system. Exercise is important for immune health. Eating properly is important for immune health. We know that sugar, for example, decreases immune function. We know that stress decreases immune function. I mean, our life experience, there are studies that medical students around exam time all get sick. And, I'm sure we can all remember how we got sick when we were stressed. And relationships are critically important. So those are the fundamental lifestyle factors that are so important, for immune health. And when we look, at COVID, believe it or not, there are studies that say if you're healthy overall, you have a healthier immune system. And that's the approach that is fundamental to functional medicine, is make people healthier. Diabetics, we need to have them get under better glycemic control in order for their immune systems, to be healthy. So making people healthier is so important. And when we look at COVID has two important things that I think are important to talk about now. Number one is this whole concept of comorbidities, meaning patients or people that have certain illnesses are more likely to have severe COVID. And those are the illnesses like heart disease and diabetes and so on. And so if you have those diseases, you're more likely to have a problem with COVID. We also know that if you look at things like vitamin D, which is so important for the immune system in so many different ways, that low vitamin D isn't good for immune health, and low vitamin D also is a problem for COVID. So everything is interrelated. And if you like, I can, talk more specifically about different, nutrients. We could do that now, or we could do that later. That make a difference, for COVID.
Sure. I mean, if you like to talk about now, is that we know that right now, during the fall, the winter, we spend more time indoors. And then also is the period where we go through the flu season. Maybe you should, talk about, what we can do, to protect ourselves. And then you can talk about the nutrients also.
Right. So it's all about getting ourselves as healthy as possible. And so everybody should see you, Ed, and you should get them to optimal health, because you know how to do that. You know how to, work with the functional medicine matrix. You know how to work with the personalized lifestyle factors, and you know how to get people healthy. And when you get people healthy from that functional medicine perspective, which is exactly what we talked about, is identifying excesses and identifying deficiencies. When you can normalize the body's physiology, that's what keeps them healthy. So it's stress reduction, sleep, eating properly, not a lot of sugar, all of those things that you know. And specifically, you want to have people achieve as ideal a body weight as possible, as normal blood sugar as possible. Vitamin C is great for immune function. Vitamin D, zinc, curcumin, which is an anti-inflammatory, quercetin. These are just all things, that make a lot of sense, and they all work to reduce viral replication, because whether it's flu or COVID, they're both viruses, right? And what people mostly get sick from are viruses. So you want to be able to increase the body's ability to fight viruses. And when we're talking specifically with COVID, we want to stop this virus from docking on its receptors and entering the cell and then replicating and assembling itself again. And so the way we do that is by working on becoming healthier, because then the ACE2 issue becomes less important. And then we want to do something called glycoprotein inactivation. Now that's a big word, but it matters because that's where the virus attaches to the receptor. And so we want to block that by eating leeks, and stinging nettle tea, for example, has been shown to be healthy. And then we talked about, the idea of supplements. So glutathione, which is an antioxidant, one of the biggest antioxidants of the body, and important for detoxification, and actually helps immune function. Green tea is wonderful for this. NAC, N-acetylcysteine, also very helpful. Resveratrol, which comes from, red grapes, is so important as well. Zinc, 30 to 60 milligrams a day. Quercetin, which I already talked about. Curcumin is also so good. So these are the types of nutrient interventions that are helpful for both flu and also COVID.
With the vitamin D is very, very important, as you mentioned. Do you have an approach? It's very important to check the level of vitamin D. Do you have any recommendations to start vitamin D for people that are just like listening? And what is the vitamin level that you think in this the range that is
I mean,
optimal?
I think, a healthy vitamin D level is somewhere between 50 and 70, closer to 70. And so I titrate. Sometimes if people are in the 20s or 30s, I'll do 50,000 units once a week, 12 weeks. If someone is in the 40s, I might do 10,000 units a day for a month or so, or 2 months. It all depends. If people are around, 50, I just give them between 2,000 and 5,000 units a day.
Okay. Would you mind us to tell us what is your morning routine?
My morning routine, well, I'll start with my pre-warning routine, which is sleep hygiene. So, I'm a believer in early to bed, early to rise. And I try not to stay up late. Weekends, sometimes, social life calls for that. But in general, I like to be asleep by 10 or 10:30. And I wake up. I try to set my life such that I can wake up without an alarm clock. Doesn't always work, but most of the time it does. And I'll wake up, and I have a ritual. I love my black coffee. I do. And I'll have my cup of coffee, and I will reflect on the day. I try not to look at the schedule in the morning. I'll look at the schedule, sometime in the afternoon, the day before, to see if I have an early morning meeting. And that's a different routine for me. But most of the time, I don't have anything early in the morning. So I don't open up my laptop or anything like that. And I'll just reflect. I'll look outside. I'm lucky enough that I have a nice view, and I can look at nature and, sip my coffee. And then I will go to meditate. And my meditation always has the three main things, which is I'll say some prayers. And after I do that, I reflect, and I try to get to a place of gratitude, because gratitude is one of the healthiest emotions to have. And no matter how stressed I am, I can feel very good about gratitude. And I find reasons for gratitude, grateful for my kids, for my professional standing, my professional colleagues and friends. And so I'll find gratitude, and then I do surrender. Surrender is so important because, you may have heard the saying, man makes plans and God laughs. We really, we really don't control things, even though we may think they do. And so I surrender, and realize that I can just do the best I can, and then the big circumstances are really out of my control. And then after I do surrender, then I just do relaxation breathing. And then I come out of that after about 20 minutes. And I might have some matcha green tea. And then I'll usually do some form of exercise, come back, shower, and start my day.
Very good. Well, in meditation, I think I always had a certain difficulty to do my meditation. And during one of your courses, you led a meditation for the students. It was kind of the first time I was able to do that. So I'm very thankful to you about that.
Oh, that's great to hear. Yeah, and meditation, the word scares people. It's really easy. I describe it as it's just something that captivates your attention so you don't look at your watch.
Yeah.
So for some people, dancing is a wonderful meditation. Some people, gardening is a meditation. When I used to do surgery was a meditation. So there are many different types.
That is very good. Is there any other advice that you give, to people to, during the period what like we will face with the flu season and the winter?
Well, I think you do the best you can. So you take care of yourself. You eat well, you sleep, you exercise, you try not to get stressed. So that's really important. And then you take those nutrients, the zinc, the glutathione, the curcumin, the quercetin, mushrooms, are also very, very good. So there's a lot of, green tea, there's a lot of immune enhancing, nutrients, and, a lot of the different supplement companies have blends. So I would go to a supplement company that you like. And I know you've done research into the supplement companies, Ed, and recommend certain things for your patients, and they all have immune boosting supplements, and that's what I would take.
That's very good. We in November we'll start a 6-week course on immune resilience, and we would love for you to participate on that too.
Great.
Well, thank you so much for all this great information. It's always a pleasure speaking and seeing you, and I'm looking forward for more things in the future.
That'd be wonderful. Thank you.
All right.